Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Ashley Morgan of Novant Health, who will talk to us about the speech therapy services available at the hospital. Then we'll speak with Dr. Thomas Braza of Summit Plastic Surgery and Dermatology about an advanced treatment for sun-damaged skin. Finally, we'll take a visit back to an interview with Randy Thompson and Peggy Starella to learn more about an upcoming golf tournament. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Ashley Morgan with Novant Health Brunswick Medical Center. Well, welcome to the show, Ashley. It's such a pleasure to have you here.
Thank you. Good to be here.
Good. Well, first of all, tell our viewers a little bit about your education and your background.
I got my bachelor's and master's degrees from Western Carolina in the big town of Cullowhee. After I graduated, I moved back home to Kernersville and worked in several skilled nursing facilities in the Winston-Salem area.
Okay, good. Well, how long have you been a speech therapist at Brunswick Medical Center?
Almost a year and a half. I started last February.
Last February, wow. Do you like it here?
I love it.
Yeah, the weather's great and it's a great place to live. So tell me more about speech therapy. I'm not so up on that, so I'd like to learn a little bit about that and talk about the services that you provide at the hospital.
Okay. I work with adults primarily. I actually haven't worked with any children since I've been in the big girl world, but it's an option. But here at the hospital, I work with inpatients and outpatients on speech and language, cognitive problems, or swallowing difficulties.
So it's more than just speech.
It is.
Let's talk a little bit about the swallowing piece. What is it that you do in terms of teaching folks to swallow?
A lot of times after someone has had a stroke or sometimes with advancing dementia or something like that, people's swallowing can decline. And so there are diet modifications, having softer foods, thicker liquids, things like that that we can adjust, or teaching them exercises or compensatory strategies to help them swallow safely. And
in terms of speech, how would that, when would you use that piece of your skill?
Very often with people who've had a stroke. That's a big portion of the patients that I do work with. Sometimes they have trouble getting the right word to come out. They know what they want to say, they just can't get that word out. Or with the weakness that typically occurs with a stroke on one side of the body, their speech may be slurred. So working on getting those muscles stronger as they recover.
And I believe you mentioned some cognitive skills. Tell me a little bit about that.
Sometimes people with dementia or just normal aging process, they'll have a little bit of memory loss or difficulty with solving problems, managing money, organizing medications, all kinds of executive functions like that we can work on.
I didn't realize that would fall under the speech pathology part.
It does.
The cognitive part. I always thought of speech pathology as speech, and I guess more related to children, in kids who talk later in their early life. That was what I always thought of. So I was surprised to hear about the cognitive piece as well as the swallowing.
Right.
Now, what kind of test would a patient have to go through to determine if they have swallowing issues?
For an inpatient I'll typically do what's called a bedside swallow evaluation, and that just consists of trying different consistencies at their bedside, just to make sure I don't see any of those red flags that would clue me in that they're aspirating or something's getting stuck, that kind of thing. We also do some other tests just to find out a little bit more what's going on. We can do a modified barium swallow study for inpatients or outpatients, and actually be able to see an x-ray.
Watch them swallow?
Right.
Is that done in x-ray?
Yes, it's done in radiology.
While they swallow the barium? Is that how that? Oh.
Doesn't taste very good.
So getting back to the bedside and the swallowing that you observe, if I understand this correctly, you offer them different types of foods or drinks, things like that, and watch how they swallow it. Is that correct?
Different consistencies, yes. I'll usually have ice chips, a thin liquid, usually just water, a liquid that's a little bit thicker than usual. We call it nectar thick, some applesauce or pudding, and then a cracker, something hard and crunchy.
Hard and crunchy. And when you see patients, is it typically covered by insurance?
Yes, yes, especially with Medicare is very good about covering speech therapy. Most insurances will cover it, yes.
Well, how about referrals? How would a patient, if they think they may have a problem, or you have a loved one at home, maybe an elderly relative that you're taking care of, and you think that they might benefit from your services, how would they go about getting an appointment, or how's that done? Would they work through their primary care?
I do need a doctor's order, so they would need to speak to their physician and have them fax me an order along with just a little bit of basic information, and then I will contact the patient or appropriate family member and get them scheduled for therapy.
And that would be the same process for inpatient, I assume, that you would, the hospitalist or the provider that's taking care of that patient would then contact you, and you would come in and begin the treatment of that patient.
Yes. Or if nursing, sometimes they'll come to me and say that they think a patient is having trouble swallowing or something like that. And then I can, of course, contact the doctor and ask for an order.
And then once the patient's discharged from the hospital, they can continue to follow up with you on an outpatient basis. Is that correct? That's great. Now, I know we've talked about the referral process and how to get the patients in to see you, but one thing I wanted to cover is if you're caring for perhaps an elderly family member at home, I wonder, are there warning signs that we should maybe look for in terms of their speech or swallowing? What might be some warning signs for us to look for?
Typically with swallowing, there is, of course, coughing that would let you know that something is probably going down the wrong way. There's also throat clearing, a change in vocal quality if after they take something to drink and then they go to speak to you and their voice sounds wet, it sounds gurgly. That's a clue that it's probably going the wrong way. If they're getting pneumonia frequently, if food or drink is being aspirated and going the wrong way into your lungs, it can often develop into pneumonia. So those can all be red flags as far as swallowing is concerned. With speech and language, any kinds of change, if they don't sound the same, if they're having trouble getting words out, if you hold up a pen, they know what this is, they just can't get that word out. For cognitive issues, things like memory, you know, our brains age like the rest of our body, so there is a normal little bit of memory loss that often comes with normal aging. But things like completely forgetting that you've even made a doctor's appointment, you know, not just forgetting what time it is, putting your keys in a completely odd place. You find them in the freezer. We all lose our keys. That's pretty normal. But
yeah, I do a lot.
Right, but putting them in bizarre places, that kind of thing.
Okay.
So.
How about children? When should a child start to talk, and when should we become alarmed about them not talking?
Typically, for very young children, if they're 1 year of age, their utterances are about one word. Same with 2 years, they're putting 2 words or so together.
I see.
And it progresses from there.
And so if we're concerned and they aren't using good speech by then, we probably should talk with our pediatrician about that, and then he would take care of getting us to the right place.
Yep, and there are early intervention companies locally. Typically, as far as I'm concerned, most of the children that I would see would be kids who are out of school for the summer, that kind of thing. So they're not getting the speech therapy in the schools anymore, and so their parents would just want to carry that through the summer. So that would be an option.
Okay, great. Well, those are all great signs, and I think that's of help to our viewers, because there's lots of folks out there caring for elderly relatives during these times, and so I think that's a very valuable source for us. Well, Ashley, it was a pleasure having you on the show today. I thank you very much for coming, and I hope to see you soon.
Thank you for having me.
Our second guest today is Dr. Thomas Braza with Summit Plastic Surgery and Dermatology. Well, welcome back to the show, Dr. Braza.
Well, thanks for having me. I appreciate it.
I think it's been about a year since we had you on last.
It's been a good year. Quick year, but good year.
They go fast.
They do go fast.
Well, great. It's a pleasure to have you back. And I think let's start off by you telling our viewers a little bit about yourself, because for the folks who didn't meet you before, let's start there.
Well, my name's Thomas Braza. I'm a dermatologist and Mohs surgeon, which is a skin cancer surgeon. And I joined a practice here about a year ago called Summit Plastic Surgery and Dermatology. I had been in Atlanta for about 8 to 9 years practicing. And our family decided it was time for a good move, and we found this job opportunity and moved here and just love it. It's been a fantastic year.
I'm sure your family's loving living here.
They do.
It's a great
Love
way of
going to the
life.
beach and pool every day. And,
Yeah, that's really nice. Well, tell us a little bit about Summit Plastic Surgery and Dermatology, about the services that you offer there.
So, well, Summit Plastic Surgery and Dermatology is kind of an all-encompassing type practice where we have general dermatology, skin cancer surgery, and also plastic surgery. So we vary from seeing patients who have rashes and acne to lots of skin cancer, and then also doing a lot of the plastic surgeries with breast implants, facelifts, tummy tucks, things like that.
All that good stuff.
All those good things, and Botox and fillers, all those things. And we have 2 offices, one in Supply and one in Wilmington.
Oh, great.
And I kind of spend my time half and half on each.
Oh, do you? That's great. Now, you said you've been with the practice about a year, so
Yes.
I assume that you've seen quite a few things while you've been here. You've done a little bit across the board, so really gotten your feet wet. But today we want to talk about a new technology and treatment called blue light therapy.
Yes.
Now, I understand that that's relatively new at the practice.
That's correct.
So tell me about blue light therapy. What is it?
So blue light is something we got about a few months ago. It's been around for probably over 5 years. My previous practice had it in Atlanta, and it's a great way to treat what we call actinic keratoses, which are these sun damaged spots we get on our skin, which we call precancer spots. And it's all done in the office. There's nothing that has to be done at home. Everything's taken care of in the office. And it's a great way to approach people's skin to reverse sun damage, get rid of a lot of the precancer spots, and really kind of clean up their skin, we call it, to help prevent skin cancers in the future.
Now, you mentioned AKs. I think you call them AKs. Tell me a little bit more about those things.
So AKs are actinic keratoses, and those are what we call the sun damaged spots. We use the term precancer. I explain to my patients when we use the term precancer, they're not something that would turn into the cancer called melanoma, which is the more scary type of cancer, but they could turn into what they call squamous cell carcinoma, which is a common skin cancer we see. And the actinic keratoses are the pre-version of a squamous cell. So when people get these from years of being in the sun, they get these kind of rough little white little spots.
Little scaly things.
Scaly little things. They can be a little sore sometimes. Sometimes they look like little horns in our skin. We like to treat them because 10% of them, so 1 out of 10 of them, might turn into skin cancer. And we just don't know which ones, and because of that, we treat them all. And there's different ways to treat these precancers. A lot of people probably had things frozen. We use liquid nitrogen.
Taken off.
So we freeze with liquid nitrogen, which is fairly straightforward. And that's good if you got 1 or 2. But some people come in, it's their whole hand, or they just got a lot of them on their face. And you can treat the ones by freezing them, but it doesn't get rid of the underlying sun damage. And so what we like to do with those people is do more of a generalized approach and treat all of the precancers. And there's different ways of doing that, from creams, chemical peels, and then this new therapy called blue light.
So how does this work? What do you put something on the skin and then you sit under a light? Or?
Yeah, so the blue light, it's called blue light because the light's blue. And what happens is the patient comes in, we put this medicine called Levulon, which is a photosensitizing medicine on their skin. So let's say we're doing their face. So we would put it on their face, and they would sit for an hour. And while they wait, the medicine gets absorbed into the precancer cells, the actinic keratosis cells, and kind of converts them into a cell that makes them very sensitive to light from the sun, and also from light just from the room. And after they sit for an hour, they sit under this blue light, and it's called that because it is blue, and it's a little machine. They just sit there. It's about 16 and a half to 17 minutes. They sit there, and then once we're done, we put sunscreen on them, put a hat on them, and send them home. Okay, but it's all done in the office, which is nice. There's nothing you have to do at home. It's all fairly straightforward. We usually have them bring a book to read or something while they're waiting for that hour.
And how long would this treatment last?
So you treat it that day. They have to stay out of the sun for 48 hours afterwards.
48 hours.
48 hours. So pretty much, if we do it on, let's say, a Thursday, no sun on Friday and Saturday. And when we mean no sun, no sun. I mean, you can't go play golf, can't play tennis. You got to really cover up and wear a thick amount of sunscreen.
Can you go outside though with a hat?
You can go outside if you have a big hat on, and we actually give people a hat.
Do you?
That the company provides for us.
And the sun doesn't penetrate.
And it's a big brim hat.
Yeah, because my husband will put on this straw hat and it has holes in it.
Yeah,
so
yeah.
I mean,
this is one of those like UV hats that blocks the sun real good. And so they have to stay out of the sun, and what to expect, what they're going to see is that it's going to get kind of red, a little scabby sometimes, almost like a sunburn.
Sunburn.
Yeah, and that heals up over the next few days, usually in about a week or so, and pretty much fairly easy to take care of. You just wash your skin like you normally would, and just like I said, be out of the sun for 48 hours. And then the results show up once it heals. Typically, we do 2 treatments about a month apart. So we treat it once, a month later we do it again. Then after that, they'll see the doctor again, just evaluate and see how everything did. People really like it because it's fairly easy for them. It's all done in the office with insurance. Medicare covers it, and if they have a private insurance, we just pre-approve it ahead of time, so people don't have to go get a prescription or anything like that. The medicine we buy and we put on the patient, so they don't have to worry about anything from a prescription standpoint. And it's they like it because it's easy. Pretty quick recovery time.
Well, if you have too many of those little spots and you get frozen, you've got all these little...
Got little spots.
So this way it does it all at one time.
Yeah, it gets the whole field, as we call it. There still may be a few left that we may need to freeze or something, or sometimes do another treatment with the blue light. But it's a great alternative than just freezing.
Say you had the top of your head done, for instance, a man.
Like me.
And would you have to have it done like in a couple more years, or
typically, so we do it, the 2 treatments, see them back for their skin check, and if things look great, maybe once every 2 years we may need to do it. Just depends on how much sun damage they've had and how well they responded.
Yeah, well, I'm curious. I heard that getting this is sort of like a chemical peel that.
Yeah, it is sort of like chemical peel. So really, it revitalizes your skin. I mean, it can, reverse the sun damage and even the skin tone. And so when you see it, your skin, and once it's gone through the process and it heals, it really looks younger because it's getting rid of all that sun damage and smoothing the skin out.
Well, I know that there are lots of other procedures that they've performed at Summit Cosmetic and Plastic Surgery, but This sounds like something new and exciting that I think folks could benefit from out
Yeah,
there.
I mean, it's great for the actinic keratosis. And, sometimes I have patients that come in all the time, we just keep freezing and freezing and freezing and just never get anywhere. And this is just a nice alternative. I mean, people tolerate it well. There's a little stinging and burning while you get it. Some patients say more than others, but it only lasts for a short period of time and are pretty pleased with the results.
Yeah. So for viewers out there who might be thinking about this or might be interested in it, where should they contact you?
Sure. Well, they can either go to our webpage, which is summitcosmeticsurgery.com, or they can call us on our number and just make an appointment. We'd like for them to see one of the providers.
Come in for a consultation first.
And usually we bring in for a skin check your skin, and then if blue light, if they're a candidate for blue light, we set that up for them after that.
And you do all the pre-approval and what have you.
And everything's
for
pre-approved
the
ahead of time.
Insurance and what have you.
Exactly.
Great. Well, don't wait for another year to come back because
I
you
know.
always have such great stuff to tell us.
Yeah, it's great.
So we look forward to having you again, and thanks for coming today.
Yeah, I appreciate it so much. Thanks.
Finally, we'll take a visit back to an interview with Peggy Starella and Randy Thompson to learn about an upcoming golf tournament. Well, welcome to the show, guys.
Thank you for having us.
It's such a pleasure to have you here. And first, I'd like for you to tell me a little bit about your role with the Novant Health Foundation Brunswick Medical Center. And how about this golf tournament that's going on?
Well, I feel like we're a liaison between the hospital and the community. And by the golf tournament, we will be supporting different functions that the foundation is going to do.
So that's just one of the many things
Yes.
that you're going to do.
Yes.
Well, I know that this is a side job for both of you. So tell me a little bit about yourself, Randy. What is it that you do now that you're retired?
Well, I am retired from local government here in Brunswick. And I own my own business. I do disaster management and have enjoyed that and enjoyed the opportunity to work with the foundation.
And how about you, Peg?
I'm retired. I live in Lockwood Folly, where the golf tournament will be. And I enjoy working with the foundation because I feel like we're helping the community.
Sure. Well, we're here today to talk about the foundation and one of its upcoming events. As we already mentioned, it's the golf tournament. But before we talk about the event, let's talk about the purpose of the foundation just a little bit. Randy, can you...
Well, I think Peg mentioned it earlier about being a liaison between the hospital foundation and the community. But we also want to make sure that we're carrying out the mission of the hospital and reaching the community in trying to come up with programs that would assist the hospital community.
And when you have events like this, then you raise funds toward those,
Yes.
those missions. Is that correct?
That is correct.
So let's talk about some of the projects that the foundation is planning and currently working on. Peg, do you want to start with that?
Well, one is a wellness. We're doing a wellness for the mothers and for the children of the community. We want the mothers to be able to have the information when they're pregnant, to be able to get all their medications, and to breast nurse more than they are now. And for the children, I believe the obesity is very high here, so we're helping with that.
Okay. And Randy, I understand there's some sort of a garden going in at the hospital?
We do. We have a garden area that we're working on with the hospital in conjunction with the volunteer group of the hospital to give everyone an area to go to outside of the care environment. And hopefully this summer it will be completed. And people will be able to enjoy that.
So it's sort of a healing and respite area
That
for
is
folks,
correct.
just to get away from it all. And will there be places for folks to eat and just sort of relax out there?
Both. You'll be able to have an area to go to for quiet time if you need it, or eating as well. So it's a combination. It's a very well orchestrated area that will work well for both environments.
Sounds lovely. I can't wait to see it.
I think
This
we're
summer,
all
right?
waiting to see it this
Yes.
summer.
Well, that sounds really neat. And so to raise money to make all these things happen, I understand there's a golf tournament. So that's what we're really here to talk about. Tell me a little bit about the golf tournament, Peg.
Okay, the golf tournament will be on a Friday, September 20th.
Okay.
And hopefully it won't rain, but if it does, it'll be held on Saturday, September 21st.
Oh, so the rain date is just the next day.
Yes,
Okay.
it is. And it's a gunshot, and it's captain's choice
What time is the gunshot?
at 8:30 in the morning, but you're
Is
welcome.
that like shotgun, gunshot?
Shotgun start.
Yeah.
Shotgun start at
Shotgun
8:30?
start, yeah. And you can, welcome to come around 7 o'clock. There'll be a buffet breakfast, and you
Okay.
sign up. And there'll be mulligans to buy, and,
Well, tell me, is this the first one?
no, this is the second,
Second one?
yes.
So let's talk about how this all works. How do people sign up? Is it a team or an individual, Randy?
You can sign up both. We have teams, individuals, and we have sponsorships.
Okay.
We
Still have sponsorships available?
We have sponsorships still available, and they range from $5,000 to $250,000. We would love to see more sponsors from the community
Sure.
involve themselves within the foundation and support the foundation through this golf tournament.
Sure. Now, I assume there's prizes to win. Am I correct?
That
Yes,
is correct.
Yes, you are.
So how many teams will place? I mean, how many, is it like first, second, and third?
Yes, yes, we have first, second, and third.
Or place
And
teams?
yes, we do.
And then we have the hole-in-one
Okay.
closest to the pin.
Okay.
We also are going to have some different things.
Closest to the line.
Closest to
and
the
then
line.
And a putting competition as well.
Oh, so does
Hole-in-one.
that, the putting competition, does that run at the same time as the golf tournament, or is that before?
Yes, it's in between hole number 18 and hole number 1. You stop and they let you putt there. It's free.
Oh, okay.
Yes, each team can stop there. It's lots of fun.
Okay. What else should the golfers know about that day? Talk to me about food and stuff like that.
Well, I'll be glad to help you out on the food.
Yeah, you're the
Yeah.
Okay, well,
You
tell
know,
me about food.
One of the biggest things that we heard from last year was the buffet luncheon that was provided after the
I
golf
heard it was
tournament.
awesome.
Oh my gosh, the caterer that was involved in it actually prepared ribs and chicken right there on
Right
the
there?
grill.
Wow, that's awesome.
And there was more food than anyone could eat. And
Ribs and chicken, right?
ribs and chicken and barbecue. I mean, it was
Everything.
a big selection of food. So no one went away hungry. That was a big treat for a lot of folks last year.
Well, good. Peg, you said something about mulligans would be available. And
Yes.
something, a captain's choice format. What is that?
Captain's choice, there's a captain of the team, and you all tee off, everybody tees off, and then he picks the best ball, or the ball he
so
thinks.
you go with the best one.
Yes.
Oh, that sounds
Yes.
like something
Yes.
I might be able to do.
Sure.
Because I'm terrible, so if I've got like 3 other people.
Anybody can do it. You don't have to have a handicap or anything. Just come and enjoy yourself. It's a fun day.
Okay. Well, if folks are interested in playing in the tournament, is there a person that they need to contact?
They can contact Sally Henry,
Mm-hmm.
and her telephone number is 910-721-1460.
Okay, and so they just call Sally and say, I'm interested, and
Yes.
are there forms to fill out, or
Yes.
she'll get all that
She'll
information
get all that
to
information
them?
to them. She
Yes.
sure will.
Okay. Well, we sure have enjoyed having you on the show today, both of you.
Well, thank
Did
you.
I forget anything? Is there anything else you want to tell us before we,
no.
about the foundation or let's hear about that foundation one more time.
Yeah, that it's here to support the community, and the way in which we are able to support the community is with funds, and this is just one of our outreach efforts.
Now, I think there are a couple other events that were going to happen this year, but
Yes.
this one coming up in September is a big one, the golf tournament. And I think there's going to be something in the fall, and we'll have more information on that.
That
Yes,
is
we
correct.
will.
So great. Well, thanks again for joining us. We hope to see you very soon, and we'll
Yes.
see you at the golf tournament.
Well,
Thank
thank
you.
you.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please visit us at atmctv.com to tell us. For more information about Novant Health Brunswick Medical Center, please visit us at novanthealth.org. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.